We are back here on Carolina Women. I am so excited today to introduce, I know a lot of people know you, Dr. Matt Epps. We're here at your office, which is phenomenal. Not only is he a physician, but he built a lot of things in here too. So he is a Renaissance man. That's what I'm going to say about you.
And
I'm super excited to talk with you today. I've known you for a lot of years. He went to school with my kids, and now you are a world acclaimed, and I'm going to say it out loud, plastic surgeon. And the office is amazing. Erin and I think would love to have you share with us a little bit about your background and what you're doing now.
absolutely. So our background was I grew up with your children, and we even played tennis with one of them on the high school about 30 years ago.
Yeah,
but
just saying.
So it drew us back into the area and to come bring sort of a higher level of just medical knowledge or plastic surgery knowledge. Not that there's some wonderful plastic surgeons here between in Bluffton and Savannah, but when it comes to specialties like oculoplastics and facial surgery and aesthetic breast surgery, I found an idea that I would come here and try to raise the bar as much as I could, having trained in New York City and Atlanta and New Orleans.
It's been really
elsewhere.
interesting to revisit with you some of the things that really do set you apart. And I think, we really want to give a broad overview and be broad spectrum today, but there's some specific things that you do that really do set you apart. The ocular surgery is one.
Yes,
Talk
ma'am.
a little bit about that.
So in my mind, oculoplastic surgery is probably, I just enjoy it. It's a very finite surgery. It's complicated. It's not as simple as...
What
What is
mean?
it?
Yeah.
I know that sounds really...
And I do this to myself all the time. So an upper lid surgery is called an upper lid blepharoplasty.
Okay.
And so if I say that, I find myself, it's my own language.
Sure.
I'm a
Right.
surgeon. And most people...
And we look at you like...
Yeah.
Exactly.
It means an upper lid or lower lid
Is
surgery.
that for like a hooded eye?
Absolutely.
Like, would I be a good candidate for that? Not to put you on the spot.
So that brings it to another thing. Well, it isn't just your eyes, it's your forehead.
Okay.
And so your forehead is often what, as we age and we descend, there's a certain point around 30s to 40-year-old age where we lose the fight with gravity, and so gravity starts to pull down. And what you find out is even if you have small lines, you're constantly getting Botox trying to lift your brows up. And really, sometimes people, to reduce hooding is just have a simple brow lift.
Okay,
Wow.
so Erin and I are all about takeaways.
Yes.
So after we interview you, we want to be able to take things away. So here's the first takeaway. Come to Dr. Epps, and can we get a consultation or an assessment, and you can actually look at, because I'm 69.
Absolutely.
Take a deeper dive.
Right, take a deeper dive. I'm
Yeah.
69 and she's 30 years younger than I am, and so our needs would be really different.
Yeah.
But that's not saying that that coming to you would be mutually exclusive.
Absolutely. And I think there's never a time where it says, hey, I'm not old enough for this, or I'm too old for this.
Right.
There just isn't. It's always a time to start, but sometimes it's just a matter of starting a conversation and you say,
Right.
here's what I think, here's some options to think about, because you never want to point out to somebody something they don't
Is it
notice.
maybe just something that bothers the person that might trigger them to say,
Absolutely.
Right.
okay, I would need
Absolutely.
to find out more about this?
Can I ask you just a basic question that you're going to be, oh my gosh. No, but the basic question is, when I hear plastic surgery, I think a lot of people don't really know. We all have an impression. Does it mean a breast implant? Does it mean something more aesthetic with my lids or eyes? Is it reconstruction? What is it?
Well, that's absolutely true. And that's the thing is the general public hears plastic surgeon and it's just, what is that?
Right.
They say that
What is it?
80 or 90% of plastic surgery training just in residency without any exclusive fellowships afterwards is reconstructive surgery. A certain subset of that's hand surgery. Has nothing to do with the breast. And no one thinks about these things.
Caused by injury or some other...
Injury or some other thing.
External.
Well, and it's just historical. And around the 90s, most of the surgeons who graduated programs in the 90s are sort of the senior surgeons now. They all did hand fellowships. That's
Got
what
it.
you did. That's before we had
So interesting.
advanced breast implants. We had even Botox and all these things
Sure.
have come around. And so the aesthetic world in plastics has exploded.
Okay.
The training hasn't quite caught up to it.
What's really interesting interesting talking today. Again, we are not doing a deep dive. We're just sort of hitting the tip of the iceberg. What would be really fun for us, and I think for our viewers too, is even us talk and kind of put together a list of things. What is plastic surgery? Just define that. Maybe talk a little bit another time about breast reconstruction, ocular plastics. I think there are so many fascinating topics for our audience and you're very user friendly. And I think that's what I love about. No, I mean it. I think that's what I love about you. You know, you're so personable and you
We've
really
known
care.
me since I was this tall.
I know. That's exactly right. I mean, I walked in, I'm like, whoa. But it's really great. I know we're out of time now, but will you come back and visit us again?
Absolutely.
I think it's really fascinating.
One of the things I'd love to talk about is just breast implants and some of the options, and especially with mastectomies, but also the whole new development of breast implant illness. And this is something that has a real place in my heart with having a background in psychology and development of that, and seeing it's an illness that is developed around implants that often is the endpoint is what's going on, and it has to do with the silicone and some of what the silicone shells are made out of.
It's so interesting. He gave us a little tease before about it, and I think it's something you're going to want to definitely listen to. So we'll get you back and let's talk about that more in depth.
Absolutely.
Thank you. Thank you. Stay with us. There's a lot more to come here on Carolina Women.